7 degrees. KNX News Time at 3:56. Well, first came Nintendo Thumb, then Guitar Hero Wrist. Now the latest affliction for the wired age is, you ready for this? Cell phone elbow. Medically known as cubital tunnel syndrome, the symptoms are numbness, tingling, and pain in the forearm and hand. Sound familiar? Orthopedic surgeon Dr. John Knight is with the Disc Sports and Spine Center in Marina del Rey.
As I'm sitting here talking to you, my elbow is in a bent position, holding the phone to my ear, and that ergonomically doesn't work for the ulnar nerve, which is a nerve that runs behind your funny bone. It's the second most common nerve to become pinched or trapped in the upper extremity. Second most common to what many have heard of as carpal tunnel syndrome, which occurs at the wrist.
So it's kind of like bumping your funny bone.
There are a lot of people that bump their funny bone, and they get that tingling into the little and ring fingers of the hand. So it's that nerve that becomes stretched or with increased pressure as a result of bending the elbow for prolonged periods of time or bending the elbow repetitively or frequently. So that nerve becomes increased swelling around the nerve, and it becomes irritated and can lead to severe nerve damage over time.
Dr. Knight has some simple advice for avoiding cell phone elbow, like talking hands-free.
Hands-free, alternating, and just decreasing the time. But most of us are addicted to our PDAs or cell phones now, and so it's easier said than done. But I think if you start getting symptoms, you got to look at this quickly so it doesn't become irreversible.
If hanging up the phone doesn't work, the next step is seeing a doctor.
Usually nerve tests are run to determine the severity of it by a neurologist, and then first treatment is anti-inflammatory medication. Therapy in some cases may be helpful. If that doesn't do it, then surgery is a last resort.
So you might want to call the doctor from a landline.
Again, if you're holding the phone in that position while you're on a landline, it can do the same thing. That's why in the office place, it's important to go with a headset for many reasons, from the neck to the fingers. The less you can hold your arm in that position, the better off.
Orthopedic surgeon Dr. John Knight, KNX News Time 3:58.